Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you very much for having me on the program.
All right, Minister, since last we spoke, we know that the Pfizer vaccine has gotten approval from the FDA. Could we have your brief thoughts on that? And then secondly, we wanted to talk about our own, I noticed that there were advertisements out inviting bids in terms of storage. So if you can speak to that as well.
Well, there are a number of vaccines that are finishing off their phase 3 trial. And Pfizer has just completed that process and then applied for emergency use authorization in the UK. And they had gotten approval in the UK, so they have rolled out vaccine distribution in the UK. And similarly, on the 11th, the FDA in the United States reviewed the documents submitted by Pfizer and have now given authorization for the use of the Pfizer vaccine in the United States. So as you can see on the television this morning, there are lots of people who are now receiving these vaccines. And they have prioritized healthcare workers, they have prioritized persons who are living in residential homes because they're at higher risk. So they have come up with their own priorities of who should get a vaccine first, and they've started that rollout process. So it's a good thing that a vaccine is now being rolled out systematically. And we expect that Moderna, which is another company that was working on a specific vaccine, their vaccine is going to be reviewed by the FDA on the 21st of December, and it is expected that shortly thereafter that they would also receive permission to roll out the vaccine. So I think this is, a ray of hope, so to speak, in all the doom and gloom that people would have experienced over the last year. So we are ending the year with a lot of optimism and the hope that vaccines would help us to end the pandemic. In terms of our preparation here, as I have said before, we have started to prepare our cold chain system. And a cold chain, vaccines, you normally would have to keep them at a certain temperature. Generally, most vaccines that we have been using would be between 2 to 8 degrees Celsius. And so we are accustomed to a system that operates within this range. We have several facilities where we store vaccine. We have a central facility in Georgetown, and we have several regional facilities. And when we go out to do immunization in remote areas, we have containers that we use to ensure that we can take out these vaccines at the appropriate temperature. At our regional facilities, because they're located sometimes in areas where there isn't any electricity, what we have done over the years is to put in fridges that operate by solar power. So we are able to have a cold environment that is good enough for keeping the vaccines safe. So we have that system in place. But this current system that we have is not going to be enough. One, we need extra space for COVID-19 vaccines. And some of the COVID-19 vaccines that are coming out on the market require special temperature, they have special temperature requirements. So for example, with the Pfizer vaccine, you have to store them at minus 70. And for the Moderna vaccine, it is at minus 20. So while we do have some freezers in the public health system that runs at minus 20, we don't have any of those minus 70 freezers. So we have to do two things. One, we have to increase the space, the physical space that we have to store vaccines. And we have started that process. We have done an evaluation. Our engineers have gone out to each of these sites, look at the space that we have, and based on that, we are now planning some expansion. We are hoping that by mid-January, a lot of this physical space would be created. We are going to do some tendering for those projects during this week, next week, so that we can have the physical space ready. We have also identified a number of suppliers for freezers. So we are going out to get some of the minus 70 freezers and some minus 20 freezers as well. And this would complement the existing cold chain that we have. So by doing that, what we are actually doing is to expand the range of our cold chain. So we would be able to take any vaccine, whether it's minus 70 to 2. So it covers all the known vaccines that are right now being talked about, and any one of those will be prepared to receive here and to do the immunization with it. So we are doing a lot of work, and so far we are making good progress. Our challenge, however, and our concern is that a lot of countries are going after the minus 70 freezers, and therefore it is expected that there would be a global glut. It would be short. So that's one of the challenges that we might face, and therefore there might be a delay in getting some of these things. Nevertheless, we are working with several partners to be able to access these types of freezers.
I wanted to ask you about our, just to recap a little bit about our training in terms of the same vaccine, and then the 3% and then the subsequent 17.
So a couple of things. We, in order to roll out the vaccine, and again, it depends on which one of the vaccines would be available to us. So those specific details, we don't have them as yet because the facility that we are working with is COVAX, and they haven't determined those things as yet. So as soon as we have that specific information, we'll include that in our training program. Nevertheless, in terms of vaccinating people, there are some basic requirements. One, you will have certain things that you have to, well, first of all, if we start with the vaccine itself, how you store the vaccine, how you transport the vaccine, those types of requirement would be part of the training. So we'd have to start from the time you receive the vaccine, how to store it appropriately, the temperature, how to monitor that, then how to reduce that temperature to make it ready when you're going to give it to somebody, right? Then the persons who are coming in to receive the vaccines, you have to talk to them, you have to give them some amount of information pertaining to the vaccine. They then have to make a decision whether they want to have the vaccine or not. And you have to also explain to them maybe what are some of the usual side effects that people would have with vaccine. These are not anything major. Most of these vaccines, you would normally have a little pain in your arm wherever you got the injection. Some people might have a slight temperature for a couple of hours, so things like that. So you explain to people what they should expect. And if these things persist, then they have to report it back so that we can keep track of what is happening. If there's any serious effect, they should also report that so that we can monitor and check and help the person as well. So all of that is involved in the training. And so the health worker that is going to be administering this vaccine would have to explain some of these things to the person. And then, of course, what we would do, we're creating some special cards, vaccination cards relating to COVID. And again, the date when you receive your first dose, how much you receive, the next date that you got to come back to get your second dose and so forth. And of course, particulars of that patient is being recorded. We keep records, plus the patient would be given a card to ensure that they have their own record and they can show that they have been immunized. And also because these vaccines are in 2 doses, so you receive the first dose, and in some types of vaccines, after 14 days, you have to get a second dose. With other vaccines, it's 21 days. In some other cases, it's 28 days. So depending on which one we have, we'll have to get people coming back for that second dose. So again, all these instructions, all these information would have to be relayed so that people understand the date that they have to return for that second dose. So there's a lot of work to be done, and all of this is being put into a manual. We have identified, or we have started to identify people in various regions that would be trained, and we'll roll out this training with everybody so that they're quite aware what they need to do and how they can do it. And I think by preparing ourselves, we'll have a smoother rollout process. We have also started looking at transportation and how you move vaccines around. And again, the conditions under which you have to move them, the types of containers that you require. So all those things, we have been looking at the logistics of how to do them and who would do them and so forth. Now, we have put out some tenders. Among the tenders that we have that is out right now is to get cold storage trucks, because a lot of places we can get there by road. And these cold storage trucks are going to, we can easily transport the vaccines at the right temperature and get it out to different areas.
All right, two things I wanted to just confirm. In terms of the rollout plan, I know people are seeing the UK now, the US, and they might think that we're behind, but in actual fact, the rollout plan is for next year, right? Yeah.
Yeah, actually, we already have a draft plan. We are now finalizing it. And again, it depends on the types of vaccines that we'll be using. So once we know that, then we can put in some more specifics in the plan, and that plan would be made available.
And just to cover all bases, we have funding in place to cover all this, because we had spoken about that before.
So yeah, we do have funding through the normal Ministry of Health budget. There's an allocation dealing with COVID-19. And so we have funds there to cover what we're doing. A lot of the things that we spoke about, the rehabilitation of existing cold storage area, the procurement of freezers, getting cold storage trucks for the transportation. A lot of these things are covered by the current budget, and we have the resources to do that.
All right, thank you, Minister. I wanted to shift just a little bit now to our COVID-19 dashboard. And I noted that our overall positive cases are about 6,000, but we have a decrease in active cases. So if you can speak to us a little bit on that.
Well, these things are going to vary, right? The good thing is that while we have increased our testing capacity and we are testing more people, we are not finding as much positives, and that can be a good thing. However, while overall nationally we have seen that slight decline, when you disaggregate it by region, we are seeing that there are some regions that now have varying levels of challenges. So, for example, in Region 7 in Bartica, we still have a relatively high number of cases. We have about 70 cases in Bartica right now, and we have been monitoring them. We just conducted an exercise in Baramita, and based on the work that we have done there, we now have about 17 cases that have been identified there. We did some other work in other interior locations, and so we might see a number of cases in those areas as well. So what we have seen over these last several weeks, um, you would have particular areas where there are spikes. Once we have aggressive measures in place, isolation, restriction of movements, and a number of other things, we are able to reduce those cases. Most people, as you know by now, would be asymptomatic or mildly symptomatic, and therefore they all get better after, say, a 10-day period. So we are able to discharge them. And that is why our recovery is so high. But unfortunately, there are about 20% of persons who get infected. They are going to come to the hospitals. And once they come to the hospital, there are some of those that are hospitalized that would also have a more severe form of COVID, which can result in them going into the ICU, and in some cases, they don't recover. So that has been a challenge to us. And over the last 24 hours, as you would know, we had another death. So our mortality, or persons who have died of COVID so far, is now at 156. So it is a constant, a constant battle to get people to understand. I know a lot of people are suffering from COVID fatigue. You don't want to wear a mask, you're fed up with keeping social distance and those types of things. But if we don't do these measures, then unfortunately there are going to be more hospitalizations and we would end up with more people dying. It's a simple thing. And I hope that people are paying heed to these things, because we all probably by now know of someone who has had COVID, or somebody who has gone into the hospital, or in some cases, persons who have died of COVID. And so while we're optimistic that our active cases are below 600, that doesn't mean that we have to be complacent. Doesn't mean that we have to be complacent. And more so, we are going into a season when people like to socialize more. We have to avoid this. And I keep repeating this. We at the task force level have been bombarded by unreasonable requests, because people have been asking us all kinds of crazy things. They want us to go reopen bars. I don't know in which world they're living in. They seem to ignore all the things that is happening with the pandemic, and they want to reopen bars. They want people to go and come to the bars and have a drink. Well, that is a recipe for spread of the infection. There are some people who want us to open indoor restaurants. And again, these things are a recipe for, spreading of infections. Other countries who have more resources than we do anticipate that they're going to have problems, and they are putting more restrictions in place. But here we have some people who I don't understand what they're looking at, or how they are, what is their understanding of how this pandemic works. And they're asking for, all these things that can increase spread. So I think what we need really is for people to be reasonable, for people to be sensible, and for people to do the right things. And these are simple. You have to wear a mask, avoid being in crowded places, and once we abide by these simple things, we can keep the spread down, and we can reduce these infections. And when we get the vaccines and we start immunizing people, then we'll start working our way out of this pandemic. But until then, we really have to take precautions. And, we got to keep emphasizing this over and over. We have prepped our health system. We have our health workers have been doing a great job. They're ready to look after patients. But that must be a last resort. And if people follow the guidance, then we'll have less patients coming to us. So I am really appealing to people to be sensible during this Christmas season.
Okay, Minister. Before I ask you to touch on specific regions, some of those that had active cases, I wanted to touch on the daily testing capacity. You did mention that just now. What is our capacity like? And from last we spoke, I know there were only 2 facilities conducting those tests.
Yeah, it's still basically those 2 facilities, the National Public Health Reference Lab and Eureka. So one is in the private sector, one is in the public sector. We, at the National Public Health Reference Lab, we have added new equipment, so our capabilities now, our capacity has increased. We can do probably about 1,500 tests or more, and you know, we have substantially expanded what we are doing there. So in terms of PCR, we are comfortable with the amount of PCR that we have been doing. On an average, now, there have been about 300-400 tests being done per day, and that has been going on for a couple of weeks now. And so far, when we do maybe about 400 tests, we are seeing probably about 30 to 40 of those tests coming back positive. So that has been a trend over the last couple of weeks, and if we need to, we can ramp up the testing and do more testing per day. So that has been some good news in terms of our testing capacity, because you know early on we had a lot of struggle with how much tests we can do. You'll recall that at one point we were struggling to do 96 tests in an 8-hour period or something like that. That has all changed drastically. And in addition to that, we are now doing the antigen tests. And so with the antigen testing, you know, we can get back results within 20 to 30 minutes. So that too is helping to improve our diagnostic capabilities.
As we wrap up now, just a brief touch on the regions that would have had spikes recently. We have Bartica, Orealla, Siparuta.
Yeah, so in Region 6 with Orealla and Siparuta, as we had predicted, the cases have come down. Now we have about 2 cases there, one in Siparuta, one in Orealla. But again, it's the way how these things are being managed. So the regional task force went in there, they did all the necessary things, and now we have seen a decline in cases. We've had some cases in New Amsterdam as well, and those have been managed, so we now have a reduction. But we still have a number of cases in Region 6. In Bartica, we have 70 cases, and so we continue to monitor Bartica, and I suspect that once the 10 days period is over, we'll be able to discharge people. So right now, the areas that are of interest to us would be Bartica. We have Linden, parts of Linden. There are some little spikes in cases there as well. And that is something that we continue to monitor. In Georgetown, there are pockets where we have seen cases. And on the East Bank as well, there are a number of cases in the Diamond area. And so that too, while they're not really high, it's an area of concern. So we'll continue to monitor those as well. So we can find, and we do have cases in every region of the country. And if people don't abide by the isolation rules and so that we have in place, they can easily pass it on to others. So people have to remain vigilant, especially during this season.
Okay, Minister. Thank you so much. Again, it was a pleasure. Looking forward to another chat tomorrow.
Good. Thank you.
All right. right, well, that's it for today's COVID-19 update. We, of course, spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.